We are seeing doctors being squeezed out of our healthcare system. And let me just say this unequivocally, that doctors are not the problem. Sometimes people think, my doctor only spent 10 minutes with me, it's a doctor's fault. But that is not something that they choose to do or wish to do. It's coming from insurance companies and pharmaceutical companies are pushing medications. They want those medications pushed. Insurance companies are saying, we're not going to pay for this unless it's A, B, and C, which it makes it very, very difficult. But doctors truly went into this because they care. People care. Unfortunately, systems don't care.
Hey, Rachel.
Hi.
How are you today?
Good. How are you?
Great. So welcome to Business Club.
Thank you.
And we're excited to have you. This is not a normal business that we see often. Someone who calls herself as a patient advocate. So I would love to know more about your background. I know that you're a patient advocate and then you've been doing this for a few years. I would love to know what got you into this business and then how has it been going so far? So a little bit background, little story, and then let's connect that to the business that you're in.
Sure. I think I was born to do this.
Okay, wow.
I really
it's
do.
A calling.
A calling, yeah.
Okay.
I just to take you back to when I was 2.
Yeah, and 2.
I was a very sick baby, and my mother and father had no idea what was wrong, but they were great narrators of being able to explain what was wrong to the doctors. And my mother was reading a magazine, and it was a Better Home and Garden magazine, and it happened to have the diagnosis of Graves' disease, which is a very, very rare disease for a child.
What disease is it?
It's a hypothyroidism disease.
Oh, hypothyroidism, okay.
So I had an overactive thyroid. I had fevers. I wasn't thriving. I was behind in walking, talking, just about everything. And my family was very worried. So when my mother took me to the pediatrician, he said to her, she doesn't have that. There's no way. And pretty much made her feel as if she was overreacting.
Right.
But, because I was sick, I didn't get better. And what happens, it becomes medical trauma because it starts oozing out in other areas.
Right.
With my development, being able to develop correctly or not correctly, but being able to develop and as other kids my own age. So they were pretty tired of she doesn't have anything wrong because Graves' disease for a baby or a child is very rare.
Okay.
So my dad took me to Johns Hopkins and it turns out that my mother was right.
And where were you there in? Were you in?
I was in Baltimore. I was in Maryland and he took me to Baltimore.
Okay.
And I saw world-renowned endocrinologists from all over the world that came in to study rare and complex diseases. And once he was able to get me to a point where I was feeling better, not cured, I had a lot of catching up to do.
Right.
So other people were walking and other people were reading and other kids my age were just way ahead of me. And what that medical trauma does is it, like I said, it oozes out in other areas. So I don't know if you're familiar with the system of, I was an IEP child because, I had an individual educational plan. Back then, it was very different than it is now.
Is it something like homeschool?
I wasn't homeschooled, but I was in, resource and, considered. They weren't quite sure what was wrong with my ability to learn, but they labeled it learning disabled. And what that really means is we don't know what's wrong, but there's something wrong.
Okay.
And it really, I believe it stemmed from going back and looking at a diagnosis that took a long time to diagnose.
Got it.
So this is where a lot of the passion comes from.
Right.
Because I realized that had we been able to catch it
at the right time,
then perhaps I would have been walking when my peers were walking and talking when my peers were talking, and I wouldn't have gone through another system just because one system sort of kind of failed me.
Yeah. So you did that, and then slowly you were able to overcome that. over a period of time you became like normal like everybody else?
Of course, I became normal. I became normal, but one of the things that I learned throughout everything is I wouldn't change it for the world.
Right.
Because what I have is resilience.
Yes, absolutely, 100%.
I mean, from that experience came years of a rough road, rough road. But I'm really good at falling down and getting up, falling down and getting up. That's
a great lesson. Yeah,
that is one of my gifts.
Yeah, absolutely. And then you went through that journey, and that kind of led you to the path that you've chosen now.
Yeah, it took me a while to get to that path. I like I said, I was always meant to be on that path.
Right.
But, I fell off path several times.
Right.
And, I'm very grateful because that's where my empathy comes from.
Right. Okay.
Knowing what it's like to struggle, knowing what it's like to work really hard and to continue to fall down. Because it just doesn't, when you start a system and you struggle, you really have to catch up. And you don't know when it's going to happen. But eventually it does when you keep working at it.
Great. So that led you to create your company, which is the Nash Patient Advocacy and Consulting.
Yes, it did. But also working for our systems, being a part of our systems, that also was a big part of it.
So you were able to understand the intricacies of how the system worked internally.
Yes.
And then you were able to navigate that into and then help the patients that are. Do you still work for them, or do you it's just your business that you?
It's just my business that I work for. I think working for the systems, working for the state of South Carolina, working for the VA, which was a shorter time period, helped me to see how the system was designed to work against people.
Right.
You have all of these resources. They define success, but it's really important for the client or the customer to define their own success.
Right, right.
And I found working for the VA especially to be an
VA stands for?
Veteran Affairs.
Oh, Veteran Affairs.
And it was under the VBA, which is the Veteran Business Administration, where I found that the veterans that needed the most help, were sent away.
Oh, okay.
And that was very frustrating for me. And veterans were, I didn't find them to be treated like people. There was a big policy book that we were given, and everything was in policy. And the thing is in life, when it comes to people, there's no one size fits all.
Right.
So I had a lot of questions. I asked a lot of questions. And, I would say in that world, I may not have been as well received.
Okay.
Because I really wanted to help my veterans. And I just am not a cog, one of the cogs in the wheel.
Right. So you wanted to give them the special attention that they needed.
Right, right.
Great. So when did you start the Nash Patient Advocacy and Consulting?
So I started it in November of 2022.
Oh, okay. After COVID. Okay.
Yeah.
And how has been the journey so far?
Interesting.
Okay.
When I started it, I had big ideas. I had big thoughts. I thought I knew what it looked like out there. And I have accomplished so much, but it's a lot different than what I anticipated.
Okay.
It's a lot harder.
Okay.
It's very individualistic.
So everything is customized.
Everything is customized. Everything. It truly is about the person that has the problems going into healthcare. It's very hard. Everything is very fragmented. You have systems that aren't always talking to each other. You have staff that sometimes they're not talking to other staff.
Right. Okay.
And it's very, very confusing for so many people. And it takes a lot of time.
So please explain to me, what does advocacy mean? I know you're advocating for the patients. And then how do they navigate through the system to reach out to you? And then if they're in a situation where they're not able to get the right treatment that they want, then they reach out to you. Is that what it is?
That's part of it.
Okay.
That's part of it. This is a very new field.
Oh, really?
It's not something that we may have needed years ago, even though there were problems. There were some problems.
Yeah, our healthcare system is broken, so might as well, it's a great opportunity to if not fix it, at least help the patients navigate through the system.
Right, right.
So that they don't suffer.
Right. And, we are seeing doctors being squeezed out of our healthcare system. And let me just say this unequivocally, that doctors are not the problem. Sometimes people think, my doctor only spent 10 minutes with me. It's the doctor's fault. But that is not something that they choose to do or wish to do. It's coming from, it's coming from higher
the
up.
corporates and the lobbyists and all that,
Insurance companies and pharmaceutical companies are pushing medications. They want those medications pushed. Insurance companies are saying, we're not going to pay for this unless it's A, B, and C, which it makes it very, very difficult because, of course, people want to get paid. But doctors truly went into this because they care.
Right.
And they are being pushed out. There are statistics out there when you look at it and you see more admin positions and less doctors. What I do is, like I said, it's very individualistic. I'll give you an example. I was asked to go to a doctor's appointment with someone, and he was on 22 different meds.
Wow.
And the doctor did a medication reconciliation. And that was something that, I recommended. I said, you might want to ask for this. And he chose to do it. I don't tell people what to do, but I give people options. And he did. And when he left that doctor's appointment, he was down to 11.
Oh, wow.
And there were some medications that were conflicting, and it was very dangerous. I've also seen where, medication errors happen. Things happen. There are mistakes that are made. So it's great to have a patient advocate, because the patient advocate is an unbiased party who's there watching, taking notes, and just really paying attention. I was working with a client who was at a nursing home, and they failed to give this individual very serious medication. And they chose not to do it because it required labs. So this person went to the hospital, and then that nursing home kicked this person out.
Wow.
I mean, it really was unfair. And the other thing is that we're starting to see is when there are mental health diagnoses, first of all, they're not supposed to be seen.
Right.
But when you take medication that shows that you have a mental health condition, that can sometimes be used against you with the next steps of trying to find aftercare. And I've seen that happen as well.
So I know you hold a couple of degrees. One is the BCPA and the other is the master's degree in vocational rehabilitation. So how does that help in your patient advocacy? Well,
the BCPA means I'm a board certified patient advocate.
Okay.
And one of the things that I love about that credential, about that certificate, is there are ethics. There's code of ethics that I follow, where I'm not just saying, hey, I'm a patient advocate. I'm not going to give legal advice. I'm not going to try to diagnose a person. And sometimes I think people think that a patient advocate maybe should be a nurse, but, and nurses make great patient advocates, let me tell you. But I don't jump into nurse role.
Yeah. So
I jump into navigation role, research role, what's happening, options, and I never tell someone what to do. My degree in vocational rehab counseling came because I worked for the state, and I was a vocational rehabilitation counselor.
Wow.
And I really, really love that. I love to help people reach their full potential.
So, do you necessarily need to know the medications, the list of medications that the doctors prescribe, and how do you kind of figure out what's good for the patient and what's not good for the patient?
And I don't need to know the medications.
Okay.
I need to know how to help them navigate it.
The system.
How to, a lot of times before going into a doctor's appointment, when someone's working with me, the questions are already prepared.
Okay.
They're in the portal. I say, okay, give that to the staff member, so the staff member can give it to the doctor.
Right.
And the doctor can review the questions.
And what are these questions generally?
Questions that, when you go to a doctor and let's say you have a question, but you forget to ask it.
Oh, the diagnosis.
Yes.
Okay, diagnosis questions.
Yes. Okay. I'm having symptoms with this. Can you tell me what that means?
So this is for the questions for the For the patients, not to the doctors.
Patients to give to the doctors.
Oh, okay. So it's questions to the patients that they can ask the doctors. Okay.
And a lot of times questions such as, could you tell me what this means?
Right.
And can you tell me where I can research it? So that way people aren't just, because it's so scary when people Dr. Google things.
Yeah.
I mean, we could have a million things wrong with us.
Right, absolutely.
But asking the doctor, tell me where I should go to research this. Can you tell me what this pain might mean? And that way you're prepared.
Right.
Because sometimes you go in and you're nervous or you may not remember. So it's really good to just have your questions prepared ahead of time.
Got it. Okay. So how do you help the patients navigate, let's say if they don't know what they're getting into? So if many times what happens is, I know, okay, let's say I'm an asthmatic and I have diabetes and I have a bunch of other things. But there may be situations where I don't know what I'm going through, right? How do you help them get to that? I mean, of course, they have to go to the doctor and get an idea as to what the diagnosis is all about. But sometimes even doctors actually fail to diagnose properly.
Fail to diagnose?
Yeah.
I say second opinion, third opinion, fourth opinion. I recommend them. You know, if you're not comfortable with what your doctor says and you feel like there's something else, we are the best narrators.
Right.
We really are. Parents are the best narrators of their children. We know ourselves best.
Right.
Can we get it out within 10 minutes? And that's why it's very good. Also, I tell people you can write a story about called The Day in the Life.
Right.
Send it to your portal because, you know, in 10 minutes, can you get all of those things out?
Got it. Okay.
You know, and that way you're addressing all of those things. And their care is so fragmented because you may have asthma, you may have diabetes, but then you're going to have to go to separate doctors.
Right.
And you want to make sure that your doctors are communicating. And that's when a patient advocate comes in to make sure that
there's that communication gap. Okay.
Yeah.
Fixed. Okay. Got it. And how do you separate yourself from your competition or from other advocates out there? How do you stand out?
Well, because this is such a new field,
Yeah.
there really aren't a lot yet of board certified patient advocates, which I want more.
Yeah, of course.
I want more. I want that competition. The more people are educated, then all of a sudden they realize they need one. But the way I stand out is because when you go to a hospital and you're having problems and you call the advocate in the hospital, their allegiance
is to the hospital.
Always to the hospital. Same thing with an insurance company.
Right.
You call the insurance company and they have a patient advocate. Their allegiance
is to the insurance company.
Right.
They take care of
VA, same thing. So my allegiance
is to the patient.
Always the patient.
How do they reach you?
Well, they can find me on my website.
Of course. But what if I did not know? I'm a normal person. I mean, honestly, if it was not for a business club, I would probably have not known you. But how do they get to know that there's something called patient advocacy?
My greatest strength has been word of mouth, customers' word of mouth. Now I have to do so much better with getting out there and speaking. Because every time I speak about patient advocacy, then all of a sudden it clicks.
Right.
I think the hardest thing for people is they don't know what it is.
Right.
You know, they may not understand. I do like to teach people on a large scale because I want people to have these skills.
It's more like workshops and okay, great.
Yeah.
So I think as we were speaking, one of the best ways is to get your voice be heard outside to the general public. So we'll talk more of that later.
Okay.
But yeah, that's very interesting. So you said you are one of the very few patient advocates in both North and South?
Yeah, there are board certified patient advocates. And I really have a lot of respect for my peers.
Right.
Because it means that they're not only complying with the same code of ethics that I am, but they're doing continuing education. And it really is a profession to be very proud of because we're
fighting for the patients.
Right, right. And we are building teams.
Right.
We are building networks. We are building a community. We are building a village, because that's what it takes.
Right.
With so many different types of people out there. People care. Unfortunately, systems don't care.
Yep. So are there any specific directories, or, do the hospitals themselves have patient advocate, not necessarily with an allegiance to the hospital, but with in general, do they promote you guys?
No.
No?
No.
Okay.
I wish so. And I really want to be seen as someone who wants to make things right, not wrong.
Yeah, of course.
So I do think there is a little bit of intimidation, and I don't understand why. Because,
intimidation from the hospital side?
yeah, I think they're
Okay.
afraid. I think they're afraid of, because people can be so litigious.
Right.
But that's not my goal. My goal is to keep somebody out of court, to keep them out of the any legal battles. That's
Right.
terrible.
Yeah, nobody wins except the lawyers.
Nobody wins. Nobody wins. So my goal is their goal is to help make sure that somebody is getting the best care that they can.
Right.
And I understand the hospitals they have shortages, they have different problems, they have, different issues, but I'm not there to find their fault.
Right.
And I think that if there's anything that I would like is for them to see that what I want is a win for them as well.
Right. From a hospital perspective.
Yes,
of course.
yes.
So let me get a little bit deeper into, payment part. I know you're a patient advocate. This is such a great thing that you're doing. So congratulations to you, and, a lot of respect to you. How do you bill someone whom you're advocating for? I mean, so if I'm a patient and I want some navigation, is it on a per hour basis, or is it a consultative? Is it project based? I hate to say the word project because it's patient.
I know.
Yeah, so I'm sorry about that. So, but how do you invoice them?
Typically, lately, I'm finding that it's project based.
Oh, really?
Because it's not just one thing; it's multifactorial. This happens, and then because that happened, this happens. Because that happened, this happens.
So there's a lot of dependencies.
Yes. But there may be one thing that needs to be done. Maybe somebody wants me to go to a doctor's appointment because they just got diagnosed with something that they don't understand. Okay. And I'm in there with my questions and making sure that there's understanding and that we don't leave until there's understanding.
So it's literally like a lawyer or an advocate for any case. In just that in this particular case, it's the patient and their health situation. Right. And then you're advocating, you're basically being there for them at that time.
Right. Now, if it does become litigious in any way, then it goes to a lawyer. Or if someone were to call me and say they want to sue someone, let me say, I do not take that case.
Okay.
I want to be present. I want to be there. I
want them.
Yeah, an opportunity to fix it.
Got it. And what are some of the challenges that you're facing while helping them navigate these situations?
I would say what I said, for individuals to see me as not as a friend, where I am coming as a friend.
Yeah, okay.
I am coming in to bring people
So there's that mindset
together. Mm-hmm. Yes. The word advocate, I don't know why, but tends to have a negative connotation.
Yeah, that's true.
People don't describe me as being a bully, but they do describe me as being a bulldog. And those are two different things.
Right.
A bully's mean. A bully is nasty.
They're mean.
Right. But a bulldog is saying, you know what, if I have to,
I will.
I will because I care about you.
So how do you help patients understand, help them navigate there's a Bill of Rights, right? Patient Bill of Rights. Do you do any walkthrough sessions with them?
I have them read them.
Okay.
And I say, do you know this exists? Nobody knows.
Oh.
Not all doctor offices, from what I understand, have to have them, but they generally do.
Okay.
But hospitals, I believe, are mandated.
Oh, really?
So, yes. Okay. So, there are rights. They have rights. And then it says, it outlines exactly what they're supposed to receive. And it's really important because it's there for them and it's there to protect them.
Right. So you read them and they understand, and then they, in case they need further clarification, they reach out to you. Is that what it is?
Yeah, but I think it empowers them.
Of course, yeah. It gives them more knowledge than what they were before.
Yeah, because now they know that, they have rights, and these things matter.
Yep. So can you just walk us through a typical case where your advocacy made a significant impact on someone's case or life?
Yeah, I can.
Please go ahead.
Many, but, since...
Pick one. You don't have to name the person. But still.
Okay. I had somebody that I worked with, and his wife was one hell of an advocate. We can be advocates, great advocates, and fantastic. I think I learned a lot from her. And I learn a lot from everybody that I work with. And she was strong. She was composed.
This is the patient's wife?
Yeah.
Okay.
And her husband was in the hospital for about 7 months. And she was working full time, and she was handling this and just a pro at it. But what happened is she was tired. She was exhausted.
Got it.
So she brought me in, and every case is different. And, I just said, what can I do? What can I do to help you? Mm-hmm. So she was, she would tell me exactly what it was that I needed to do to help her. And I want to say, was in the hospital for about 11 months. And he was diagnosed with failure to thrive. That was it. They kind of said, he's really not going to make it.
Right.
But long story short, he went to a teaching hospital, and he's doing amazing.
Wow.
So it's really the power of never giving up. And that when I go back to I fall down. I know we didn't get it.
You get up, yeah.
I get up, and that's really the energy that I bring with with all my cases. I also think being there with someone that was on 22 medications.
Bring them down to 11.
Right. Bring them down to 11 and encouraging people they don't have to accept the status quo. In 5 minutes, you don't have to go on medication that the doctor said. Go ahead, let's research it first.
Right.
Then go back. So it's fascinating.
It's fascinating. It's never ending, and it's so much of satisfaction at the end of the day. Mm-hmm. Right? Okay.
Yeah. One more I'd like to share.
Sure. Yeah. Please feel. Yeah.
I had a gentleman who was in a very bad nursing home. Just going to say it because I'm not going to state the name. And he was there for rehabilitation, and they were leaving him in bed for 23 hours a day.
Wow.
And his wife called and said, I need your help. So we got him out. Because you need rehab.
Yep.
And he was digressing, and he really needed that. So, that was one that, they end up, all my customers end up as they become family. And then at that point, I can't take them again because then it's then it becomes the bias. So, but the whole thing with patient advocacy and the way I see it is to come in, solve a problem, and teach. And
it's like, okay.
Yeah, and then I don't want them to be dependent forever. I think it would be taking advantage. Oh,
absolutely. So you basically help them, take the horse to the water and help them. But, at the end of the day, they have to swallow it and they have to drink it and learn how to do it further and further again.
For themselves.
Yeah, for themselves.
Yeah.
Great. I also, was talking to you earlier. You said one of the things that you deal for the patients is to deal with the insurance. And when you deal with the insurance, has there been any situation where they have reversed cases or reversed the charges that they've billed?
Yeah. I think it seems like everybody has a different insurance plan.
Right.
So you don't get to see like this fits everybody when it comes to insurance as a whole. Mm. So really it's about, for what I've noticed for me and what works is, first of all, looking to see if there's any mistakes that are being made, connecting with calling the insurance company and connecting.
Right.
Being nice, being kind.
Yeah.
I think people sometimes they go from 0 to 60 really quick, and then the other person on the phone just no longer, unfortunately, wants to help you. So it's really connecting and going and saying, hey, can you help me out here? Can you teach me something? It's okay. I always say this, and and I don't know what you think of it because you're in business, but I always say, like, I can be the dumbest person in the room and be okay with it. Because I get to be the smartest person when I leave. Not the smartest, but I learn from this person and that person and this person. So I'm always asking questions.
Makes
so
sense.
I certainly, when I call an insurance company, I don't tell them what to do, but I ask them questions. What can you do? And I try to make this person, because I'm not emotionally invested the way somebody else would be, a family member, I humanize this person. And then all of a sudden, I believe it clicks. Now, if I call an insurance company and I know right off the bat that this person does not feel kind to me, I just hang up and start over.
Okay.
It's as easy as that.
Makes sense. So what role does mental health advocacy play in your practice, and why is it such a critical component?
This is huge. First of all, I struggle myself. And that goes back to medical trauma.
Yeah.
It does. Because when you want to be caught up with everybody, but you're really behind, and you just keep going and you keep going forward, but you struggle.
Right.
It kind of leads. It can lead to there's different schools of thought, of course, with mental health, but it's really hard out there because there's a power differential, because there's so much stigma centered around mental health.
Right.
So I've seen it. I was working with a client, and she went in and she said the counselor said that they needed to get credentialed before they
What does credential mean?
Credentialed with her insurance.
Okay.
So she told the client, she said, I'm gonna make it pro bono until
the insurance agrees to pay.
Yes, insurance. So every appointment. Well, fast forward 6 months, she gets a huge bill. I happen to be present. So I wrote a letter and I said, hey, I was present. She tried to take care of it herself, but they weren't listening to her, because you have the power differential,
right.
A mental health patient, and they treat us badly.
Right.
They really do. I've witnessed it. I've experienced it. So when I got involved and said, you know what, I was there. I know exactly what happened. Here's the documentation that I took, the notes from the day and what was discussed. Then all of a sudden she didn't have to pay it.
Wow. So you were able to reverse that, basically.
Yes. Also, there is I have seen where people that have mental health diagnoses are made to feel made to feel worse about themselves. I just have to share.
It's kind of a stigma.
Yeah. I had this. I just want to share one more story.
Sure. Yeah. Absolutely.
This family hired me in Seneca, South Carolina, and they had a young man who was really struggling, and it was assumed that he had a mental health condition.
Was assumed.
Wow. Assumed. So, and his parents wanted more than anything to help him. And system after system after system after system failed. He was in his late 30s, African American, and it almost seemed like he was being abused by the state mental health system. Just abusive.
Right.
And we did everything we could. To try to get residential treatment for him, just so he could get well. And every time we tried something, it just failed. It failed. It seemed like the system was not there for him at all. And I said to to his mother, I said, I feel terrible. I can't solve this. I cannot solve this. So we made a decision to reevaluate him to see what was really going on.
Right.
Because of these crazy 10-minute diagnoses, And there was just something there. There was, with my experience at Voc Rehab and working with adults who were neurodiverse,
Right.
there was something there. So we did, he had an evaluation, and he's neurodiverse. And here was a system that was abusing him.
Wow.
So that was like the golden ticket for us. And it made a world of difference. But it's still very hard.
Yep.
We were able to apply for assistance and resources. There were a lot of resources out there, but it changed. It was a game changer. But shame on
The system. Yeah.
shame, really. So, but and to see parents get blamed. I mean,
That's ridiculous.
Yeah. So I would say that there's no one condition that I can't work with. But when it comes to mental health, I really understand that the system's even harder than it already is.
Yeah, that's so tough on the patients. Okay. So you've seen the rise of telehealth. How has that impacted your advocacy services?
I worry about telehealth for a few reasons. I think in some ways it's good,
Because people are able to access it.
Yeah, more access.
Yeah.
But for example, there was somebody that I was working with at one of the hospitals, and he had ALS, and he wasn't doing well. He was declining, and the hospital didn't have a neurologist on staff, so they had a video for a neurologist. There are a couple things they couldn't see. Could
Yeah.
be his color, his eye gaze, his how was he shaking,
Right.
all of these things. And I look back to my own health and when I was at Johns Hopkins, and I have vivid memories because I was there for years.
Oh, really? Wow.
Years until I was about 13 years old.
Wow.
And I used to spend a whole half a day with these doctors. Like
And
I
you
said,
kind of studied them, how they kind of behaved with you. And
yes. I mean, they would look at my hands. They would look at my fingernails. They would look at the color of my face. They would look at my eyes. They would put things on my head, and they were
There
constantly
were physical touches that made
physical touches, and then they were constantly talking and communicating. And even the gentleman that went to the teaching hospital, his wife was telling me that the doctors were always communicating. And that explains why he got the best care. And when he went into that hospital, they didn't say, we know what's wrong, but we're going to find out.
Right.
And that's okay. That is okay. But the system really struggles with complex issues.
So what you're saying is telehealth is good for certain aspects, but in most cases where they need that physical in-person presence, telehealth kind of fails miserably.
Right.
That's why you still think that your advocacy matters a lot.
I do. And for doctors to, even when they're in the room, and if they're on their computer the whole time, they're still failing the patient.
Right.
Because I believe but I don't blame them so much. I really do blame the system when it comes to that, because I still am very, very pro doctor.
Yep. Yeah, I can see that.
Yeah.
So from a healthcare system perspective, what changes would you like to see in the healthcare system? I know you're patient advocates, obviously you'll advocate for patients, but the certain things can be changed in the system. What would that be?
I think to understand that there is no such thing as a one size fits all.
Everybody is different.
Right. And people are going to react differently.
Yep.
To understand what someone's baseline is, to care, to go back to caring.
Right. Get to the basics.
Yeah.
Interesting. And how do you keep yourself informed about what's happening in that world? Okay, there's a lot of changes that are happening in the healthcare systems and other things. So how do you keep yourself?
I read.
You read.
I read, but I'm also, with being a board certified patient advocate, I do continuing education. I stay in touch with my cohort. I stay in touch with my peers. And I'm constantly asking questions. I mean, that will never, that will always be my questions I ask everybody.
Right. So the patient advocates are basically private pay professionals. Now, can you explain why this independence is essential? What it would mean from the whole system perspective, because you are there as an unbiased person. So if you can just get into the details, that would be great.
Well, imagine if an insurance company hired me and somebody's fighting.
Your allegiance is to the insurance company.
Yeah, and somebody's fighting against a policy. Then, the insurance company may say, no, we don't want to pay this.
Right.
Where I want to find a loophole. I want to find a person that can help me understand. I want to see what's going on, why. I want to ask the whys. I also want to ask the whys, not just, if a practice were to hire me, not necessarily a practice, but a hospital system, it's not about just putting somebody on medication. Why?
Right.
What is the issue at hand so we can understand the why? Because I have also seen it where somebody was put on medication, the medication didn't work, and then they got put on another medication, that didn't work, and then they got really sick from the medication. Worse. So the question is why? I was hired by a doctor, which was one of my neatest things I think that's ever happened, because, a wonderful doctor, retired doctor, who was a great doctor when he was practicing. And, he hired me because he wanted, him and his wife wanted help with helping navigate it for their loved one. So, that was
rewarding.
It was rewarding. It still is rewarding. And it made me feel like what I do really, really matters.
Yeah, of course. It touches lives and it makes them better from a position of not being cared to a position of care.
And I love it. I love it when a doctor is so happy that I'm there. And I have experienced that.
So the doctors want you there. It's the system that doesn't want you there.
I have experienced it where more than not, doctors were thankful that I was there.
Wow.
Because I somehow made it easier.
And it makes their life much better because, and it gives them an image as to, for the reason that they're there.
And when somebody doesn't want me there, it typically has not been doctors. When somebody doesn't want me there, I believe there's a reason.
Of course.
And who knows what that reason is, but that's not ever my focus, because my focus remains that person, the patient.
Got it. Do you see patient advocacy field growing in the coming years?
Absolutely. Unless we see
a huge dramatic change in the healthcare system.
That's okay. I'll go back to vocational rehab counseling. Or I can, I love what I do, but it's okay. If I'm out of a job because the systems are better, that's great. That's what I want.
Yep. The ultimate idea is to make sure that the system works for everyone and not just for the ones with the money.
Right. Yep. Right.
Cool. If someone is overwhelmed with the health crisis, what's the first step that they should take to regain control?
Take a breath.
Take a breath.
Mm-hmm. It's the hardest thing to do. Take a breath, because we react, and when we react, it kind of has a snowball effect.
Right.
That is the very first thing to do. And don't Dr. Google it. Don't Dr. Google it, because that makes it worse. Yeah. I've done that, and it's a horrible thing to do. I've had multiple things wrong with me based on Dr. Google.
Right.
So, when I go in to see my doctor, I listen. It's very important to listen and to take a step back. Makes
sense. Mm-hmm. So this is a question that I ask all the entrepreneurs who come to my show. So Aryan is 22 years old, 23 years old, just a graduate, trying to get into this wonderful world of business and other things. Assuming that he was not getting into business, but he wants to become a patient advocate like you, what are the things that he must do to be able to, because he's compassionate, He wants to help others. But there are so many people out there who wants to get into nursing or being a patient advocate, but they don't know where to start. So how do you help them navigate that part of the system to get where you are today?
I believe, and this is just my opinion, is that life experience is so important to be able to really understand, because much of what we do is empathy.
Right.
And really understanding what someone is going through without any bias, though. And that would be something that I think happens. And with, you would have a background in social services of some sort, or helping people.
You don't have to be a medically qualified person to get into advocacy?
You have to have a bachelor's.
Okay.
Like a bachelor's degree, but you have to have, and I'd have to go back and look, possibly in case management, working in the hospital system, working for a nonprofit, having that type of experience, or even having maybe a personal experience of caring for someone along with that. And then you apply, and then you study.
Where do they apply?
Through the
BCPA?
Yeah.
So this is a very demanding role, right? How do you maintain compassion and empathy?
Because I'm fueled by what happens to people. I'm fueled by the anger, but I compartmentalize anger, and it causes me to just fight in a good way, because this could happen to all of us. Some of it's probably happened to me in some ways, medically, and I really am fueled by my heart and the fact that I don't want to quit for people, but that doesn't mean I can solve all problems. So if it's something I can't solve, I don't take the case.
Sure,
I don't take, I just can't.
You filter the ones that you think you can help them with.
That I can solve.
Great.
And that has to do with what they want solved, not what I want solved for them.
Right. Makes sense. So what has been the most rewarding part of your career at Nash Patient Advocacy so far?
Seeing people get what they need and getting well.
And get it on time as well.
Getting well.
Okay, getting well. Okay.
Getting well, getting their results that they want, and feeling like they're heard. Sometimes early on I'll say to people, I haven't done anything yet. Some people will thank me, and I'm like, I haven't done anything. But you care and you're listening. But I haven't done anything yet. Because even the healthcare system, people feel lost. They don't feel cared about. So those things matter too.
Makes sense.
Yeah.
Thank you for that. So what legacy would you like to leave through Nash Patient Advocacy?
Advocates everywhere.
So it doesn't matter even though they're competitors? So you want everybody?
Yeah, it's okay. Competitors are fine.
Because they make the system better.
They make the system better, and they're educating too. They're educating as well. There's enough room for more of us.
Yep.
There really are.
And many people do need that care and attention to help them navigate that system.
Right. The only thing that will be different about us is our brands.
Right.
And how we, but for the most part, if you go through that and your heart's in it and you're compassionate, they're going to make a difference. There's so many people that just need help.
Absolutely. So now we are getting into some interesting, we'll just make it a little bit lighter. It's a section called rapid fire questions.
Okay.
They're not really 1 minute or 2 minute answers. It take as much time as you want.
Okay.
There is no restriction on the length at which you can go.
Okay.
However, some of them are pretty simple and straightforward. So I'll ask you some questions.
Okay.
And feel free not to answer if you don't feel like okay. So coffee or tea?
Coffee.
Coffee?
Yeah, coffee.
Morning or evening?
As far as morning.
Morning coffee? Okay.
Morning coffee.
Empty stomach?
Yes. Yes.
Okay. Black coffee or
cream? Lots of cream.
Okay,
a little bit of coffee with my cream.
A lot of people like black coffee.
I can't. It's too bitter.
Too bitter. Okay.
Yeah.
Morning person or night owl?
I'm a morning person.
Incidentally, almost everybody who has come here has said they're a morning person.
Yeah.
Okay. Cool. Why? Why so?
My focus is there.
Okay.
I'm very focused in the morning. Cool. And at night, I'm like, so,
groggy.
Yeah.
One word that describes your advocacy role.
Oh, can I have two?
Yeah, free.
Resilient
Yeah.
and compassionate.
Passionate, empathetic too.
Yeah, that one. I'll give you that one too.
Good. Favorite book on healthcare or advocacy?
I hope I get the name right, but it's Why Everyone Needs a Patient Advocate.
Oh, really? Okay,
Yeah.
there's a book like that?
There is. Yeah.
Oh, wow. Who has written that to you?
Trish Torrey.
Okay.
Trish Torrey. I hope I got her name right.
Oh, we'll put it out there.
Yeah, yeah.
We'll Amazon it.
Yeah, she's great. She's done a couple other books as well. The 10 Worst Mistakes That You Can Make in Healthcare. Yeah, really a big fan of her.
Amazing. What's a skill that every patient advocate must have?
Empathy.
Empathy.
Absolutely. That's where you just don't give up. You know, you understand compassion, empathy, and I want to say resilience too, because you got to keep going.
Right.
Going. Yeah, you can't just, you're going to get lots of no's.
Yep.
You're going to get lots of no's, and you just have to keep going back and keep pushing and pushing. And that's why people give up on their care, because they're tired. They're exhausted. And healthcare is very fragmented.
I can imagine. And I can connect back to when you said compartmentalize before you advocate or while during the advocacy. It makes sense. What's the biggest misconception about patient advocacy? I think you mentioned this little.
Yeah, I think that that everybody can do it, and a lot of people can.
Yeah.
There's amazing family members, that we're an actual profession, and that we have continuing education. We have tenets that we code of ethics that we have to subscribe to that I feel are important, not just that I have to.
Right.
I follow them because I believe in them.
Makes sense.
Yeah, that we are a profession, and we are not as biased as a family member might be, and we have people's, we're watching all sides, we're seeing all sides, we're documenting, we're paying attention,
Right.
and we want wellness for the individuals that we're working with. I know for me alone, I keep a very small caseload because it's I want to do the opposite of what healthcare is doing, not the same.
So you don't want more, you want quality.
Quality. It's all about quality.
So, you deal with so many issues. You see a lot of no's, and then how do you keep yourself motivated?
I think it's my anger. I think it's a different anger than a personal anger.
Yeah.
It's not the same.
It's the anger with the system.
Yes. It absolutely is
And
the
what
anger with
you've
the
gone
system.
through it and what others are going through it. Why can't this be set
We're
right?
going to win this. We're going to win this for the patient. We're not going to give
The
up.
right spirit, yeah.
That's right.
Got it. What rewarding client success story in one sentence?
What is it?
Most rewarding client success story in one sentence. Any client success story that you want to share?
They thought I was going to die, but I'm far from there.
That's okay.
Is that okay?
Yeah, absolutely. Why not? I know it's your story.
I'm alive. I mean, I'm alive, and I'm well.
Yeah,
I'm alive, unwell. They thought I was going to die, but here I am, and I'm doing well.
And you're doing a podcast show, so
Yeah.
it's good. It's good. I'm glad that you're here. You're very, very motivating indeed. So, healthcare jargon, frustrating or fascinating?
Fascinating. Yeah, I think it's fascinating.
Really?
Yeah, and frustrating to people.
Frustrating to the advocate, to the patients. Mm-hmm. But for you, from your perspective, it's fascinating because you're actually helping them get what they want. Okay.
Where I can just say, hey, could you explain that? What does that mean? Could you clarify that? Oh, well, sure, no problem. And people are very reasonable.
Yep.
Doctors are very reasonable.
Of course. Yeah, my doctor is great. So shout out to him. Preferred way to unwind after a long day?
Oh, this is probably bad, but
that's okay.
To say this, but to get closer to solving something. Yeah.
Cool.
Because I think it's hard to unwind when it's not solved. I don't think I ever turn it off. And healthcare doesn't. People. It's funny because you have hours. You have holiday hours or you have hours, but people don't stop getting sick.
It's perennial.
Yeah.
So if you could change one thing about the healthcare system, what would that be? One thing.
caring, everybody to remember to care. Stop, everybody's so busy, and they have all tasks, and it's related to what they're told to do. Take a moment.
And maybe they should have something called code of caring.
Yeah.
Never know. One tech tool or app that you would, that you would find indispensable.
Oh my gosh. Steve had told me about Perplexity.
Oh, yeah.
I have found CEOs on there. I have found emails, valuable emails, phone numbers.
Perplexity.ai, for those of you who don't know.
I mean, I've called people that wished I hadn't called them to say, hey, I want you to know what's happening down here.
Right.
Boots on the ground. I know you're up here. And they're like, who is this? I am a patient advocate. And then, I don't want them to ever stop with Perplexity AI.
Yep.
It's amazing. And I mean, I collect these addresses and names, and it just gives me so much access. And the other one, too, is LinkedIn Navigation.
Sales Navigator, yeah.
Sales Navigator, because I have the same, I can kind of go back and forth and rate these people. Now, whether they're reading them, I don't know, but it doesn't stop me from writing.
Right, absolutely. And do you ever get a response?
Typically, from when I call, yes.
Okay, they
when
do.
I call. But when I email on Navigator, I don't know. I don't know. But I'm writing, and I don't stop writing, because there was one incident where there was something that was happening in a hospital, and I wrote the CEO, and then within a few days it did get resolved.
Oh, wow. Okay.
So I don't know.
You don't know if the CEO is the one who actually resolved it, but it got resolved.
Yeah, she got my letters.
Got it. You go to strategy for handling the difficult conversations.
For different conversations?
Difficult conversations.
That's what I have to do.
No, but what's your go-to strategy? Is there any particular strategy that you follow?
Being direct.
Being direct?
And transparent. Yeah.
Okay. Any particular client feedback that's is most memorable?
Yeah. One of my first clients who hired me to help with billing. When I first got the job, I was so excited. So I just went to work, and I worked, and she was frustrated with me. And she said, I didn't hire you to be a hamster in the cage. And I got my feelings hurt.
Yeah.
What does that mean? She said, I want you to hear me. And then all of a sudden, it
dawned on you.
It did. And she's still a customer.
Oh.
But I so appreciated that advice.
Yeah.
Because it wasn't just about, like in the systems, you work, or you do this. But it was really about
trying to hear.
Right. So
Listen
that was right.
Interesting. What's the biggest challenge that you've overcome in your career?
The biggest challenge? When people are unwilling to
listen to you.
Well, they don't. When people are unwilling, when you have a system that's unwilling to bring in a patient advocate as part of a solution,
right?
As a team, and if a system has pushback because of maybe the word advocate.
Yep.
Or maybe fear, or who knows what it is, because those conversations, even though I try to have them, some systems may not want to have them. Cool.
Any healthcare hero or role model that you would like to mention? Yeah.
Oh, yeah. I mean, I had an advocate when I was young. And she was an educational advocate. And her name was Marge Liburn. And she fought for me. And she did some things that nobody really does. She, definitely is the true word of an advocate. And she did it kindly,
She's professionally.
Your hero. Yeah, absolutely. Then I have two more.
Sure, yeah, go ahead.
Betsy O'Brien, who is, I want to say, in Tri-County Piedmont NAMI. She's the president on the board. And she just has spent her life educating and being there for a community when mental health needs to be on the forefront.
Got it.
And then one more, and that is her name is Susan Gibson, and she was in the nursing field for many, many years, and she's just been an advocate to her family, and she's real good at helping so many people navigate the system. So,
cool.
Yeah, I'm very lucky.
So you have so many moving parts in what you do, right? How do you stay organized?
That's what keeps me organized. I love the moving parts.
So moving parts is what actually helps you stay organized?
Yeah,
Wow.
It's never boring. It's never boring.
It's fascinating.
Yeah, I love to do.
Cool.
Yeah.
Any fun fact that you want to share with the audience about you or your company?
I would say maybe that people don't believe me, but I'm a shy person.
No, you're not shy.
Nobody believes me. Nobody believes me. And with Nash Patient Advocacy, I think the fun fact is I had a guidance counselor. I think this happens to a lot of us. When I was in middle school, and he told me I would never go to college. I think he saw me in a different type of field.
Yeah.
I'm not sure what that was. But, you know, I did go back late. I did complete everything that I set out to do. And I believe that my business is going to continue to change lives.
Absolutely. It will. From what I heard, you're going to do amazing, and you're going to help and change many, many, many lives. So what's next for Nash Patient Advocacy?
I live another day. Being in business was brand new to me. It really was. I've had to learn. I've struggled in the last 2 years. I've been fortunate with people hiring me.
Right.
And that's been great, because I know that's the biggest thing for a new business is getting customers. So I've been fortunate. It is ebb and flow. But I've had to learn to be my own IT person, to be my own marketing person. All of the things, all of these hats that can be very difficult. Yeah. I'd love to just be in the thick of things.
Right.
I would love to see my business grow.
Yep.
And to be able to have individuals contract with me so they can be patient advocates, and I can teach other patient advocates so they can do what I do and help more people.
Rachel, it's been a pleasure talking to you.
Thank you.
When you told me that you were nervous, to be honest, I was also a little bit nervous that you were nervous, but then you did fantastic.
Thank
you answered all the questions with poise and calm, and very excited about what's in store for you. And I wish you all the very best.
Thank you. Thank you so much. Thank you.
One thing I would love to talk, I missed this question, so I'll ask you. You've been coming to Business Club, for quite, I think, a couple of weeks, or maybe 2-3 times you've come. I always ask this question to everybody who comes on the show, and recently I've started doing it. So I would love to know what you like about Business Club and what you don't like about Business Club.
Well, I like Business Club because there's very interesting people that seem to really care about what you're doing. And when I have presented, I think I presented only twice, the feedback has been amazing. And it's given me a platform to be able to talk in a way I can practice.
Right.
And it's okay. And the way people engage afterwards, the feedback is very constructive. And when I leave, I always feel warm, spiritually lifted in some way, because I feel that there's such kindness and care in the room. And then I wonder why I don't come more often. That's the thing that when I come, I'm like, why didn't I come last week and the week before? And I will say that in my business, the one thing that I am deficient at is networking. Because if I can put it off because I'm doing something else, that's what I push off. And that's not good, because that is going to catch up, because everything we do has a consequence. I don't think there's anything that I don't like.
Good to know, but you feel free to say.
Yeah, I really don't think there's anything that I don't like, other than I wish that I would
do it more often.
Yeah, kind of push myself a little harder to come. But I do feel, it's funny, but I'm nervous about it changing a little bit because I like the way it is, because I didn't come enough.
It's going to get better. It's going to get better and better and better. So yeah, we'll speak more about it, but you'll be surprised what's in store in 2025.
Okay.
Yep.
All right.
A good way.
Okay.
So again, once again, thank you for
Thank you.
coming, and it was a pleasure having you. And I would love to have you more.
Absolutely.
And I want to get into the depth and the meat of what you do,
Okay.
and how we can actually help others, through patient advocacy.
Wonderful.
So,
Thank you.
Thank you. Thank you so much. Hey guys, I hope you really liked the video, and if you did, please like, subscribe, and comment. And we would like to reach many more small business owners. I would really appreciate if you can share the video with them as well. Thank you, and see you until next time. Have a great one.